Hello guys, so today we are going to see two things, uh, antibacterial spectrum of aminoglycoside and your pharmacokinetic of aminoglycosides. Okay, so let's start with the first antibacterial spectrum. So let's start with the antibacterial spectrum of aminoglycosides. So first one is aminoglycosides are active against the majority of aerobic gram-negative bacilli. So aminoglycosides are active against your majority of aerobic gram-negative bacilli. Okay, so second is this aminoglycosides are also active against the multi-drug resistant species such as your Pseudomonas aeruginosa, Klebsiella pneumoniae, and Enterobacter species. Okay, so this aminoglycosides are also active against your multi-drug resistant species. Example of this multi-drug resistant species are your Pseudomonas aeruginosa, then your Klebsiella pneumoniae, and Enterobacter species. So these aminoglycosides are active against all these three multi-resistant species, and aminoglycosides often combine with beta-lactam antibiotics. Aminoglycosides are often combined with beta-lactam antibiotics for the treatment of infective endocarditis caused by some gram-positive enterococcus that is given for the treatment of infection caused by enterococcus. So generally, always remember, generally these aminoglycosides are not given for the gram-positive. It is only given for the gram-negative bacilli. That also aerobic, but in combination with beta-lactam, they can be given for the gram-positive strains also. But these two are generally the causative organism of your infective endocarditis. Okay, so this is some of the antibacterial spectrum of aminoglycosides. Now, quickly move on to the pharmacokinetic of aminoglycosides. So let's see the pharmacokinetics. So first and foremost, it is poorly absorbed from GIT since it is a polar in nature. So it is poorly absorbed from GIT. Okay, then this all aminoglycosides are rapidly absorbed. All aminoglycosides are rapidly absorbed from intramuscular site, absorbed from the intramuscular site of injection. Okay, so from where they have been given the intramuscular injection, from that side it will be rapidly absorbed, but it cannot be given orally. See, the third point is very important. This Aminoglycosides are generally found to be in high concentration, highly distributed in renal cortex and endolimbs and perilymph of the ear. Okay, so these aminoglycosides have high concentration, are found in the renal cortex and the endolymph and perilymph of the ear. Okay, so that's the reason why this aminoglycosides will cause your kidney problem, renal problem, means nephrotoxicity and ototoxicity problem in your ear. Okay, because it is deposited, it is found in high concentration in the renal cortex and the endolymph and perilymph of the ear, so it may cause it will generally cause your nephrotoxicity and ototoxicity. So that's why along with this aminoglycosides we should not give any other ototoxic drugs like cisplatin and loop diuretics. So this will have synergistic effect in causing the nephrotoxicity and ototoxicity. So next is if there is inflammation. So during the inflammation, there will be increase in the penetration of this aminoglycoside into the peritoneal and pericardial cavity. Okay, if the inflammation is there, so this inflammation increases the penetration of aminoglycosides into peritoneal and pericardial cavities. And the next is this if we administer this aminoglycoside to a woman who are pregnant, so it may result in the accumulation of the drug in the fetal plasma and amniotic fluid. Okay, so if we administer this aminoglycoside to the woman who are pregnant, it may cause in the accumulation okay. So especially drugs like your streptomycin and tobramycins can cause hearing loss in children uh, born to a woman who received the drug during pregnancy. So suppose if a woman who is pregnant receives the aminoglycoside, So the children who will be born maybe having hearing problem, or uh, maybe unable to hear, or hearing loss will be there in that type of children. uh, this should be avoided. Definitely this aminoglycosides should be avoided in the in during the pregnancy. Okay, so it may cause, especially drugs like your streptomycin and tropramycin, can cause hearing loss in children's born to women who received the drug during pregnancy. So definitely this aminoglycosides should be avoided during the pregnancy. So next, these aminoglycosides are generally excreted, or they are entirely excreted by the glomerular filtration. Okay, they are excreted almost entirely by glomerular filtration, and they will achieve a urine concentration of around your 50 to 200 microgram per ml. Okay, urine concentration, they will achieve this urine concentration of around 50 to 200 microgram per ml. Okay, and another thing is this, they have a half life. Okay, they have a half life, plasma half life of 2 to 3 hours in patients with normal renal function. They have a half life of, that is your plasma half life of around 2 to 3 hours in patient with normal renal function. But this plasma half life will be increased in case of neonates. Okay, in case of neonates, the plasma half life may be 8 to 11 hours. So while giving aminoglycosides in neonates, due to some reason, it may be, so it should be monitored very carefully. Okay, should be monitored very carefully, because the plasma half life of adult men or women will be different from the neonates. Okay, so it will be there in the plasma for a longer time in the neonates, in the children's. So it should be monitored whenever these aminoglycosides are given to neonate or children's. Okay, so in children's it will be around 5 hours. So this is all about the pharmacokinetic of the uh, aminoglycosides. So that's all for today. Thank you very much, and don't forget to subscribe the channel and press the like button. Thank you very much for listening to the lecture patiently.